Welcome to the first video series about mental health, specifically everything around education in mental health. Today's video we'll be talking about the A to G assessment in mental health to give you a refresher on how to do a comprehensive physical assessment. Historically, people have always seen mental health as a separate entity, whereas physical health nurses are very skilled in the physical health assessment. But in reality, when we're looking after our patients in mental health, we know that they don't just come with mental health issues or illness, they're accompanied with physical health issues as well. So the reason why we do an A to G assessment on all our consumers is to make sure we don't miss any physical health issues while they're an inpatient in mental health. This will apply to the young mental health clinician to upskill them on a comprehensive physical assessment. However, also enhance the clinical nurses or nurses on the floor who've been doing it for a long time. A to G assessment complements what we've been already doing and provides a structured way we can do our physical health assessment. With the introduction done, let's go through a refresher of what A to G assessments looks like. In nursing, we love acronyms. A to G assessment is A for airway, B for breathing, C for circulation, D for disability, E exposure, F for fluids, and G for glucose. The A to G is structured in the priority of care. So airway is most important, breathing, circulation. The other acronyms are there so we can be reminded to do a comprehensive assessment. Under airway, we are looking for whether or not the airway is patent and unobstructed. If you're talking to a patient and they're speaking in full sentences, that is almost the airway assessment done. From that, you can tell that it's patent and that they're speaking in full sentences. In mental health, 99% of the time, that will be the case. On the rare chance that someone's physically deteriorating, you can take note of certain airway sounds that may indicate that the airway is obstructed. For example, stridor, a strange sound that comes when the airway is partially blocked. Other sounds that people may hear is choking or aspiration. So when you swallow something, it goes down the wrong way, it can cause some airway obstructions or noises. Breathing. So as nurses, we assess breathing almost on a day-to-day basis. Even something simple as the vital signs. You'll be looking at things like respiration rate. How fast is the person breathing? Are they hyperventilating, which is greater than 20 breaths a minute? Or are they underventilated? Are they hyperventilating, less than 10 breaths a minute? We also look at things like the saturation of oxygen in the blood. As we know, the pulse oximeter can tell us whether or not someone is hypoxic, so low, hypo, low, or hyperoxygenated. Those are fundamentally what you look for in breathing. And what else do you look for? What happens when you go for a run, a sprint? What happens to your breathing when you go for a sprint? If you go for a sprint, your respirate rate will increase, your work of breathing will increase, meaning your accessory muscles around your diaphragm, your ribs will be being used to increase the respiration. This is important to know because when we're documenting, if someone's at rest and hyperventilating, this can cause some issues. Work of breathing or increased labored breathing can be very taxing on the body. So those muscles will tire over time. So that is what we also look for when we're doing breathing, the work of breathing. So simply put, in breathing, you can document the saturation rate, the respiration rate, and the work of breathing. Is it unlabored or is it labored breathing? You can also take note of equal rise and fall of chest. So the lungs in your chest, your chest should be rising equally as you breathe in and out. If one is rising more than the other, this could suggest something wrong with one of the lobes of the lungs. C is for circulation. When we're doing our vital signs as nurses, we do circulation assessment all the time. Things like the heart rate or the pulse rate and blood pressure. So is the blood pressure within the normal between the flags, or is it outside the range? Are they really hypertensive, so really high, or hypo, low? Hypo, I remember hypo, low. Are they hypotensive? And also your heart rate. Anything greater than 120 beats per minute, would suggest that the heart is working quite over time, and at maintaining at that level for a long time is dangerous. So those are the main things we look for in circulation. However, you can also look for things like capillary refill. So if you take your finger and you squeeze it, the color of the finger should return back to normal in under 3 seconds. That is a normal capillary refill. And other simple assessments you can do is the person warm to touch? Say when you're doing the blood pressure, you take note that they're well perfused, they're warm. Those are some of the assessments you can do with circulation. D stands for disability. Disability, we're looking at the person's level of consciousness. Essentially, what we want to know is the person alert and orientated? So to test for level of alertness, we look at the eyes. If the eyes are open, like you are watching this video right now, then you are alert. If it goes into verbal, where I need to verbally wake you up, then they respond verbal. If they remain still, that the eyes are still closed, you will progress to the next one, which is pain. So I would do a pain stimulus, generally a squeeze of the trapezius, which is enough of a pain stimulus to wake the person up. If they respond to pain, they respond to pain. And the last one, which is the worst, is U for unresponsive or unconscious. To test for orientation, we ask 3 things. TPP, which is time, person, and place. Do they know the rough time or month or year? Generally, I ask whether they know what month and year it is, because sometimes I don't know what day it is myself. Person, do they know their name? And place, do they know where they are? These 3 questions can assess the person's orientation. Something that falls under disability is also the GCS, also known as the Glasgow Coma Scale. This is a slightly more in-depth assessment of someone's neurological or brain functioning. GCS we can break down in a further video if people would want some more information on GCS. E stands for exposure. How I remember exposure is if you take off the clothes or the patient's gown to see the skin integrity. Essentially, exposure, you're looking for any abnormalities found on the skin, whether that be a pressure area from someone sitting or laying down in one spot for too long, or whether there's any active bleeding. For exposure, you can also document here the person's temperature. Now, why is exposure important? So let's say you're looking after a patient and you do the vital signs. You notice that their blood pressure is 70/30, terrible blood pressure, really low. Heart rate is 140. If you go through airway, breathing, circulation, and disability, and you stop there, you notice that the blood pressure is bad when you're doing the circulation. But if you stop there and don't do E for exposure, you don't take off the clothing or you don't take off the patient's bed sheet, you missed that they had self-harmed and potentially been bleeding out onto the bed, which is causing the low blood pressure. So that is why we go through the A to G assessment, to make sure we don't miss any of those details or red flags. F for fluids. Is the person eating? Are they drinking? What's the urine output like? Are they opening the bowels? Now, in mental health, we're not as specific. We don't count the mils or liters of fluids coming in. We generally have a vague idea. Are they eating enough? Are they drinking enough? This is relevant because some of our patients become catatonic, meaning they're not motivated to get out of bed or physically, mentally feel like they're not wanting to move or eat or drink. So this is very important for us to take note, especially for these consumers who may not eat or drink, therefore can decompensate. G for glucose. Glucose level of the blood, we can do a test with the blood sugar level machine. A little prick on the finger, you can get a little drop of blood, which can tell us how much sugar is circulating through the system. Anything less than 4 millimoles per liter of glucose in the system, it can indicate that they are potentially becoming hypoglycemic, so low glycemic, low sugar. Low sugars can lead to loss of consciousness or organ shutdown. Or are they hyperglycemic, high sugars? These are common in people who are diabetic. And there you have it, guys. That's a quick refresher on A to G assessments in mental health. Again, A for airway. Is it patent? B for breathing. What is their respiration rate? What is their saturation? Circulation. What's their blood pressure? What's their heart rate? Disability. What's the GCS or level of consciousness? E exposure. What is their skin like? F for fluids, are they eating and drinking? And G, glucose, how is their sugar levels? Thank you so much for watching this video and refreshing yourself on A to G assessments. If you found the video helpful, make sure you share with your colleagues to refresh on how to do A to G assessments in mental health. Thanks guys, see you for the next topic.